Good afternoon to the communities and those tuning in surrounding Northern Westchester Hospital. Certainly this is a unique time in history, and we're grateful for those who have dedicated this time this afternoon to give us a chance to give you an update on the hospital, how we're doing, for you to have an opportunity to connect to us and ask questions and things that are on your mind. I'd like to start briefly, if I may, with a couple of statistics, just to give you a sense of where we are here at Northern Westchester Hospital. And remember, Northern Westchester is a part of Northwell Health. So anytime we reference Northwell, that is the same, that is our parent company. And we are a family of 23 hospitals across the New York metro area. Our closest hospital that we may reference is Phelps Hospital in Tarrytown here in Westchester. So to get us started, and for those of you who just joined, we'll do introductions. Again, my name is Derek Anderson. I am the Executive Director of Northern Westchester Hospital. I've had the privilege in the last 3 months to step into this role, and certainly it has been a fascinating experience to join such an amazing team at such an incredible time. Dr. Marla Koroly, you'll see on the screen, is our Chief Medical Officer and our Senior Vice President for Medical Affairs. And you'll see in the upper left is Gina Picinich, our fine mayor here in Mount Kisco. So thank you to both of them for joining us this afternoon also. You'll see Dr. Koroly with a mask on. Currently in the hospital, we have implemented, and this was now 3 weeks ago, all team members of Northern Westchester and any visitors coming in, we do mask. That's a preventative measure to help further stop the spread of this virus. So how is the hospital doing today? Where are we as of, let's say, 10 minutes ago? We have 70 COVID positive patients that are currently being treated within the hospital as we speak. These are patients that have been admitted to the hospital. We have, over the past week, seen a pretty dramatic increase in that number for two reasons. And if I look back a week ago, we were more than half of that amount. So we were, let's say, in the high 20s. We're now close to 70. That number is out of context, hard to understand. If you look across Northwell Health, currently within all of Northwell hospitals, that is 23 hospitals across the New York metro area, we have approximately 2,500, close to 3,000 patients. The number constantly changes that are actively being treated within the inpatient or hospital setting. Now, there are a number of additional patients that are coming into our ER. And so far, we have seen several hundred patients in the past 3 weeks come into the emergency room of Northern Westchester Hospital. From a statistical standpoint, about 50% of those patients are test positive, and about 50% of them end up testing negative. A majority of our patients that are coming into our ER actually end up going home. They do not require or are ill enough to require an inpatient hospital stay. And we want them to be in the best location possible to heal. And for many of our patients, that is home. For those who are being admitted to the hospital, now to come full circle back to the number that I gave you a few moments ago, we have 70 patients currently. That number has doubled in the last week. And we believe, based on current projections, that we're going to continue to see a rise in cases. This is expected. We're not sure what the number will be or exactly where we will be in a week from now, but we know that the number continues to rise for the entire New York metro area. And really, this is nationally, we're seeing this phenomenon. I know many of you are probably wondering about the hospital's capacity and our ability to run additional patients. And I do want to say that currently the hospital is a little bit above 50% full, which means we still have almost 50% capacity to increase should additional patients need the care or services of the hospital. We met the governor's expectation a week ago to provide a plan that would get us 50% and 100% beyond our normal operating capacity. So this hospital is well positioned, but clearly this virus is unpredictable in many ways. And as the days progress, we have to continually stay vigilant and ahead of what we're thinking and what we're seeing in the data. Of the patients who are coming into our hospital, we are seeing a number of patients that end up in the ICU, our intensive care units, which is the most advanced level here hospital, on ventilators. That is consistent with what you see in other hospitals in the region. And of those patients who are on ventilators, the question typically comes, how many ventilators do you have? I will say that we are well positioned from an equipment standpoint. We're only using between 30 and 40% of our total capacity right now. So we can virtually double and within a few days be able to triple the number of patients, if needed, that require ventilation in our ICU if the need should arise. So we are here for you as a community. We have capacity. Every day is different, and this could change very quickly, as we have seen it change over the past week. But as things change, there's a team here that is ready and monitoring the situation 24/7 to be able to respond. Another question that has come up that I'd like to address in kind of the beginning stages of this WebEx is the topic of PPE. I want to thank all of you in the community who have donated PPE. These are masks, gowns, suits, hairnets, booties for our shoes. Our clinical teams on the front line have what they need right now. Again, this situation is very fluid. We're constantly looking at our store levels to make sure that we have what we need for our clinicians, our physicians and doctors, our nurses, and those who are supporting the front lines. So from a PPE standpoint, certainly we're in a place of strength. Our teams have what they need. We have received in many donations from many of you for cloth or homemade masks. We are holding those and they are in the ready should we get to the point that we have to deploy them. At this point, our team is not using them. But again, the days will come and things may change. We're hoping to not have to tap into those resources. But if we do, we have a community here that's been willing and able to supply us with some of that. So thank you. We also want to just mention a complete gratitude for the amount of community support that has been shown to our hospital here. And as you can imagine, as you've maybe seen in different parts of the country, this is bringing a level of stress that our hospitals are not used to. And our teams are professionals, they are strong, they're resilient. But all that being said, they are still human and there is a lot left to come. And as we look at our community that's here to support us, from food, donations, many of you have been so generous with food, with handwritten notes, signs outside the hospital. I came in this morning to a group that was doing sidewalk chalk in front of the hospital with notes of gratitude for our teams. And so thank you. All of those things lift our spirits, the team spirits. And as our clinicians will continue to be here day in and day out to make sure that we're leading the fight against this virus, we know that we're doing that with the support of all of you. So thank you. So with that, I want to give Mayor Picinich a chance to address generically before we get into questions, and then also Dr. Koroly, who's on the line. I want to give both of them the opportunity to speak to any key points or statistics that are important for us as a community to know at this time. Mayor Picinich.
Great, thank you. Derek, I appreciate that. I think we're having a problem with the Facebook feed right now. I don't think Facebook is actually live. So I just want to point that out. I'm not sure if the other connection, there was another connection, I believe, on the Northwell website.
So Gina, for those who are tuning in, and for those who are on the line, there is between Zoom and Facebook an approximate 5-minute delay as the information connects and streams. And so everything that we're seeing live now is in catch-up mode when it hits Facebook Live.
Okay, so good to know. So first I want to say thank you to both of you. One of the biggest concerns that I think people have right now in this really, really challenging time is if something does go wrong, if I'm ill, will I be able to be cared for? And in the many, many conversations that we've had, you've made it quite clear that Northern Westchester Hospital started planning for this type of situation well before it actually happened and struck us in Northern Westchester. We had spoken about the fact that you dusted off some preconceived surge plans and were able to actually start putting those in place. So I think an important message for everyone is that the plans that are in place right now were well thought out, well conceived, and you've got the ability to flex to meet the needs of the community. But I think it's also really important to note that's only so long as the number of cases don't rise so extensively. So in the end, the responsibility is on all of us that are not ill to ensure we do all that we can to abide by, the governor's New York pause regulations, all of the executive orders that say you really need to stay home. Unless you are genuinely an essential worker and you are providing a service that people cannot function without, you need to stay home. Again, solitary exercise, understood. A walk with your family or a bicycle ride, understood. But it's important that we all do our part. And it's not easy for any of us, but imagine what's going on right now in the hospital. More patients, high stress, great intensity for everyone who's literally putting their lives on the line. So I think it's important that we all remember that the best thing that we can do is quite simply stay home. And I think that's a message that needs to be reinforced. I also just want to point out that Northern Westchester Hospital is not Mount Kisco centric. We're very fortunate that Northern Westchester Hospital is here in our community, but it's important to know that the surrounding communities are part of their constituency as well. And so all of the supervisors in Newcastle, North Castle, Bedford, Pound Ridge, Somers, Yorktown, North Salem, Lewisboro, they're all actively involved in what's going on. And so the hospital and Derek have been very much in touch with them as well. And we all operate collaboratively to ensure that we can do what we can to assist and that we all have the latest information to share with our communities.
Excellent. Thank you very much, Mayor.
Okay.
Dr.
Okay, so hello, everybody. Thanks for joining. And I want to thank Derek and Gina for your comments, which I so well agree with. So to Gina's point about what everybody needs to do, the social distancing and the only going out for absolutely necessary reasons is exactly what we have to do here at the hospital. Similarly, to keep our staff, our patients, the visitors, and the whole community safe. So we are doing our version of social distancing as well. We've changed all of our meetings at the hospital that we could change to become remote. Any staff members that aren't directly involved in frontline patient care can work from home. If they can, we're having them do that. And then two other, Jarek mentioned the protective equipment and the supplies that protect us and protect patients and protect visitors and staff. But in addition, I just also want to remind everyone about the importance of hand washing. If I had to pick one thing that was the most important thing to keep everyone safe, it would actually be hand washing, because you don't realize how many things you touch throughout the day and how many times you touch your face, and that's how you're going to transmit it. And we probably average touch our faces 2,000 times a day on average. When I put this mask on, it's not necessarily going to protect the air from coming into me, this type of mask, but you see people walking around in it all over, and that's largely because for me, it reminds me not to touch my face, and that's really important. So you keep washing your hands and not touching your face. So those are the kinds of things we're doing here. And one of the things that Gina pointed out is people were concerned, what if I need to get care? What if I don't have COVID, but I need some other type of care? So what we're doing is working on how to make sure that everybody has the care they need. However, along the lines of social distancing, we are stopping things that aren't essential and delaying them to a future date. We're doing that for two main reasons. Number one, we don't want to exhaust our resources. And number two, that's our other version of social distancing. So we have a whole bunch of procedures, for example, elective surgical procedures. And we look at each one and we decide, do we really need to do that now? Because if we do it now, that patient might have a worse outcome and might be more exposed to other people. So can we safely delay it? And if we can, we do. And we reschedule it for a later date when this is all over. Nobody knows exactly when that will be. Similar for other types of procedures. Now wouldn't be the time to have a routine screening mammogram. However, if you fall and hit your head, you might need to get a CAT scan of your head. So it really depends largely on the urgency and time sensitivity of the procedure. So by canceling some of these procedures till a later date, we prevent other people from coming in for more, to improve social distancing, and we also allow our resources to expand the hospital capacity. We have surgeons who aren't doing some of their elective procedures. They're helping our critical care physicians and our hospitalists, and it's great. They're spending their time doing that because we have a surge of more patients than we typically have. So our intensive care unit, which is typically 15 patients, can now double to 33. Our medical service, which is usually 70 patients, can double to 130 or 140, but we need staff and physicians to take care of all these patients, so that's what we're working on. So we have canceled certain things and delayed certain things. However, it's very important for our community to still know that we're here and not to delay essential medical care. So if you're having an acute medical problem that needs care, you need to come to the emergency room, you absolutely need to do that. Concern of a stroke, a heart attack, chest pain, heart failure, pneumonia, severe infections, people that have things other than COVID still need to come here, and we're here to provide that care. We're making sure that we have resources allocated to that as well. Of course, labor and delivery, maternity, that's not stopping, so we have that. But we're doing it in a very careful way to protect all of these patients from exposure, to protect staff, to protect visitors. We've limited visitation. We've essentially stopped all visitation, which isn't always pleasant, but it's essential for the safety of everyone. We have a few exceptions. If someone is here to have a baby, their partner can be here on labor and delivery and on maternity. If it's a pediatric patient that's getting admitted, a parent or guardian always can be with them. And if there is someone unfortunate to be having end-of-life type of care, we would let family come one at a time and visit them. So we have some exceptions, but that's very different from our usual model of visitation. The other thing I want to mention is just as part of the Northwell system, we have the benefit of having a vast amount of expertise at our fingertips. This is a really difficult disease. There's no proven therapy. The data on anything is extremely sparse and weak and not high quality, and that's not what we're used to. but it's what we have right now. So we have certain protocols of medications that we give to people that come in when they do have COVID-19. We're following these protocols. We're all across the board discussing them every day throughout the Northwell system so that we have certain standards of care that we're going to adhere to. There's some drugs that aren't FDA approved and proven yet, but theoretically they might work. So in severe cases, we've all agreed we're going to make those available to certain patients for certain indications. In addition, Northwell has been involved in 2 major clinical trials for drugs that block some of the inflammatory response that leads people to get very sick from COVID-19. One is with a drug called remdesivir and the other one sarilumab. Those trials opened and closed very quickly because they want to get the data out as quickly as they can. And they actually took place at our busier Northwell hospitals to get a high enough population to be able to get good data from these studies. So we're hoping every day we look at it, we review it, external, internal, all these calls and conversations, and revise what we're doing. So whatever I tell you is our standard of care today, it's likely going to change tomorrow and be very different by next week. We're also in the process of working on additional clinical trials that we're designing, working on to approve and deploy with various companies with various new drugs. So more to come on that, but we're doing all that we can to make sure we're giving the best known care that's possible for this disease.
Great. Excellent. Thank you, Dr. Koroly. A question came in. So with that, I think we want to move into a few questions. A question came in. How are you protecting your staff during this virus fight? And so a couple of things. One is we spoke earlier about our supply of PPE, making sure they have the right levels of PPE in the right setting is the number one most important thing for us to do. And our staff have adequate supplies at this point. Again, dynamics may change. This may develop more extreme, hard to say, but right now we are well positioned from a supply chain standpoint to have our team with the right tools that they need. In addition, we are on a very kind of micro level providing our teams with scrubs who are in COVID areas so they do not have to go home to their families in the same scrubs that they have been working all day in. We're trying to do a lot around staff amenities that lessen the stress of our team. And what do I mean by that? Strong partnership with the Boys and Girls Club gave us the opportunity with the Boys and Girls Club here in Mount Kisco to open childcare options for some of our nursing and support teams and physicians who may need childcare as they're trying to meet the expectation here at the hospital with their shifts. And we appreciate the Boys and Girls Club for doing that. In addition to that, as we think about making sure our teams are well supplied with PPE, we're making sure that they have the right level of support. So as we've seen our ICU number increase, we have been giving our critical care teams, the nurses and the physicians in the ICU, supplemental staff to help make sure that they're providing the highest level of care. So that is in the form of nurses that may not be critically care trained, but they're there supporting their colleagues in the ICU, in the ED, and across the hospital. So there are many ways that we're supporting our teams through this. PPE is certainly one aspect, and that keeps them safe. We are almost obsessive about hand washing and cleanliness. There is a smell of bleach that I may never actually remove. I can smell it now everywhere I go, but the hospital is clean and we're being hyper vigilant to make sure that we're doing our part, even though we're treating the disease here, but doing our part for those who are traversing the hospital, that we're not spreading it further. So I hope that answers that question.
Yeah.
So another,
Derek,
yeah, Gina, please.
I'm sorry, I had a question from someone from the community that had asked if it's okay if I pop that out there.
Of course.
Okay, this was for, I think, Dr. Koroly. So there's been questions about whether you should be taking Motrin or Advil if you're sick. Can you provide any guidance on that or debunk anything
Yeah.
as it relates to that?
There was some very, very early weak studies that said you had a worse outcome if you took something like Advil or Motrin, which is ibuprofen, if you have COVID, than if you took Tylenol. The data are very weak. They're not proven. If somebody really needs to be on ibuprofen, they should take it. However, we're using Tylenol as our first choice just in case, but it's not high quality data. It's very anecdotal. But here at the hospital, if somebody comes in and we want to treat their fevers, we're giving them acetaminophen or Tylenol. And at any point, if that didn't work and we needed to give them ibuprofen, we absolutely would.
Great. Folks are saying, another question that came in was, we're going out to the grocery store, we're doing all this shopping, but then we're coming home and we're trying to wash off all our grocery bags and wash off, the things, if things come in, a container, wash off the containers and all of that. Is that something we should be doing? At what level should we be cleaning?
I think we have to be reasonable. You can't possibly clean every single thing you touch. If you're going to, like, for example, this morning I had to fill my car up with gas and I was going to touch the lever, and I put gloves on because 1,000 people touched it before me. That's not something I would have ever thought of before. But in the grocery store, if you could get things that are, wiped down and not touched by multiple people, that's fine. The food itself, eating food is probably not a way that we're transmitting the virus. So it's probably not from that. But again, being mindful of when you touch all these things, coming home and washing your hands and trying to avoid touching your face is still the biggest thing. There's always going to be germs on everywhere and everything you touch. But, that's why you have to keep cleaning your hands. So some containers, you can wipe them down and do the best you can, but I wouldn't focus as much on that as the hands.
Okay. There's also been a lot of questions about ventilators, a lot of conversations around and surrounding ventilators. And we understand this is a respiratory infection, so that's an essential piece of equipment. So the question I think that folks are asking is, what is the availability and the preparedness of the hospital and the capacity as it relates to that type of equipment?
Yeah, absolutely. Gina, I'm happy to speak to that. So currently we are using only about 35% of the total ventilators that we have here on the hospital campus. So we have a long way to go to accommodate those patients that may need ventilators. I will say also that we have patients who are improving and have been extubated and transitioned to a lower level of care that ultimately puts them on a path to go home. So as you can imagine then, as patients improve and come off a ventilator, that does free up that ventilator. So it's a moving target. But from a capacity and a supply standpoint on our ventilators, again, we're only using about 1/3 of what we have physically on site. And should we get to that level, we have access to ventilators through our partners and colleagues at Northwell Health. And then if we have to go beyond that, we have additional devices that would be perfectly safe for care that we're thinking that are coming out in literature as we speak. So as far as ventilators go, the hospital again is well positioned. We do appreciate we have community members who have donated BiPAP machines, and there is literature coming out, although we're still vetting it and understanding it to make sure that we're being safe, that potentially a BiPAP machine could be changed to support ventilation. Again, that question is coming up. We're still looking through the literature to make sure that that's the right and the safe thing to do. But ventilator proper, again, we're only using really about 1/3 of what we can accomplish here at the hospital. So we're, again, in a good position.
I just got a Facebook question about precautions for labor and delivery. So as I mentioned earlier, that's something that obviously we're not going to delay. Someone's going to be pregnant and they're going to have their baby here. A lot of hospitals have had complete restriction of visitation, not even allowing the partner to come accompany the woman who's delivering, and we are not in favor of that. So we're still allowing the partner to be present. During the actual pushing or delivery portion, everybody, again, is wearing protective devices, masks, gowns, gloves, eye shields, everything that they can, so that in the room, they're not going to be exposed. So we're talking right now, the women that come to us in labor and delivery, we screen them for symptoms before they get here. And if we think there's any chance they have symptoms of COVID, we would test them and we would put them in a separate room in a different area. And then there's a whole process by which we educate them on how to care for their newborn. Unfortunately, it's a very challenging time for two parents or a mom to have a baby and not be able to have as close a contact with the baby as they normally would. However, if the mother has the COVID virus, we have to protect the baby from getting it. There right now is no evidence that it's transmitted through the placenta during pregnancy, and no evidence that it would be transmitted from breast milk. So women can still nurse as they normally would. The risk is just touching, holding, contacting the baby. So that would have to be done with gloves and masks and all that kind of protection. So we have a whole process to educate women who are positive. We are in the process of considering whether we want to automatically test all women that come, even if they don't have symptoms. That's very controversial right now. As we expand our capacity to be able to test, we may be able to do that, but a lot of people, obstetricians and other experts, are thinking that through to decide if that's the right process. So right now we're only testing them if they have symptoms and then instituting the appropriate barriers.
Great. Thank you, Dr. Koroly. Another question came in, are we separating COVID and non-COVID patients? And the answer to that is yes. And we've been doing this since day one. As patients arrive at our ER, or whether they come in directly from another hospital, these patients are immediately isolated with the right nursing care. And we're segregating floors and units and pods of the hospital for patients dedicated to COVID and those who are non-COVID. And we're trying to keep that separation as clear and as clean as possible. As you can imagine, as the number of patients increase, one of the advantages we have here at Northern Westchester Hospital is that a majority of our rooms at the hospital are private rooms, which allows us to, again, provide isolation and a comfortable room without the need to share. So it's separating patients upon arrival to make sure that they're isolated and in the right level of care. And then the cohort or the broader scope of patients is being cohorted by floor. And so we have designated areas that are COVID and non-COVID. Tying this to what Dr. Koroly was just saying around our OB population and those coming in to deliver, that is on a separate floor of the hospital. And there are no COVID patients onto that. As you can imagine, all of our patients but particularly our young ones, we are protecting, and they're on a separate floor. So the answer to that, in short, is yes. Another question, Dr. Koroly, that came up is, I know you addressed this earlier on, but could you spend just a couple of minutes again talking about routine care, and should folks be avoiding the emergency department at this time?
So routine care, again, needs to go on. There's certain things that are urgent, emergent, and you can't not get the care at the appropriate time. So if you have an emergency situation at home and you need to come to the emergency room, you absolutely should. Again, I mentioned a few things earlier: concern about having an acute stroke, a heart attack, some kind of injury or trauma. Those are things that can't wait. Severe abdominal pain. Certain things need to be addressed right away. So we're here for that. Our physicians are still on call and available to take care of all that. If you ever have a question, should I go to the ER, should I not? You can call your doctor and get their advice. You don't have to show up. You can make a phone call and get their opinion. And if they believe you need to go, they'll advise you as such. So we're worried that, some people will be afraid to come to the emergency department and have bad outcomes because of that. So I really want to stress the importance of getting the care you need. I was just going to say some of how we define emergent, urgent, elective is quite controversial. If you're having an acute stroke and you have blood in your brain and that needs to be evacuated, we all agree that that's emergent. It cannot wait. If you're having a facelift, some of you may disagree with me. I'm going to call that elective. It could probably wait indefinitely. But then there's some gray zones. There are people that have breast cancer, tiny breast cancer, and it's going to grow very, very slowly. So should they get treatment now and then get chemotherapy that's going to weaken their immune system and make them more susceptible to COVID? Or should they wait 2 months and let the cancer sit and do it surgically later? So those are really, really challenging struggles for all of us. And again, no one wants to be alone in making such a decision. So we have oncology experts and surgeons, and we all throughout the Northwell system, we talk about these questions every day on a case-by-case basis so that we can give the best informed outcome for the patient. And of course, the patient's going to weigh in that decision too when we share all that information. So, but again, I got a little on a tangent, but certain things can't wait and you need to come to the ER if that happens.
Yeah, and I just wanted to give an example. A beloved community member, an older gentleman, had a heart issue just the other day. And one might be fearful because you don't want to be in the hospital at this time. But of course, he went to the emergency room and he stayed overnight. He was separated from other patients. He is doing quite well. And so the standard care that we've grown used to, the standard extraordinary care that we've grown used to here at Northern Westchester Hospital is continuing on. And so that we should not let our fear overcome our reason. And I think that that's really important to keep in mind.
Yeah, that's a great point, Gina, and I'm glad you shared that story. We had another patient earlier this week who came in with an acute stroke, and a pretty severe one. And the usual team that always takes care of stroke was on it right away, got there, gave them TPA, which is a clot-busting drug that breaks up the clot. We transferred them to Phelps, our sister hospital, and they did another procedure. This person is walking and talking without any deficits, totally well. That would not be the case if that person was afraid to come here, and it was a great outcome. So again, a key message. There was another question that just came in related to testing. So testing's been really challenging. It's been, initially, there was a very, very limited supply of tests everywhere. We send all of our tests, initially, we were sending them to a central Northwell system. It took a long time for the FDA to test and validate the test for COVID. It's a swab. You put a Q-tip swab through your nose, deep into the throat. Some people call it touching the brain, though we're not really touching the brain, but it's pretty deep. And then that swab goes to the lab and is tested for the presence of that virus. So initially, we limited testing to certain indications. We were not testing people without symptoms. We test people only if they have typical symptoms that we think are COVID, and then either we could send them home or admit them to the hospital, and then we wait for the test results. Initially, the test results in our system and in commercial laboratories were taking almost a week to come back. We're now down to about a 24-hour turnaround time, and we have some new products that we're testing and working on controlling so that we'll be able to do a more rapid turnaround, maybe 10 to 15 minutes at various hospitals. But again, the capacity of that test is limited, so we have to think about prioritizing who needs the quick result, who can wait 24 hours, et cetera. The other population that we're about to start testing are patients that have to undergo surgical procedures. We want to know in advance if they're COVID positive, even if they have no symptoms, because it impacts how we care for them. It impacts their risk. If they're COVID positive, they might have a higher risk of complications. We want to be prepared for all that. So our surgeons pushed for this, and we were able to implement doing that. So we're going to start that next week. Without symptoms in general, other than that limited surgical population and possibly in the future the obstetrical population, we don't recommend testing at this time. If the whole country or the whole state decided they wanted to do a whole population study, they would have to give us a huge supply of tests and be able to do that on people without symptoms. And other countries have done that. We're just not, in this country, we're not doing that yet.
Yes.
Great. Excellent. Dr. Koroly, if that's okay, I'm going to bring up two questions that came up, and then Gina, I'll hand it over to you after this. So the two questions that have come up is, number one, has the hospital accepting transfers or patients from outside of our community? And the answer to that is yes. Hospitals within New York City and parts of Long Island are seeing a much higher volume of patients, COVID patients, than we see in Upper Westchester. Because of that, and because of our tight connections with Northwell, we constantly are talking and looking at ways that we can help colleagues across other hospitals. And every day there are a couple of patients that end up getting admitted to this hospital who had come from a different hospital, and primarily from Queens. The hospitals, as you may have seen, Forest Hills, Valley Stream, Elmhurst, these hospitals are seeing a incredibly high volume of COVID patients, and more than their hospital structure and systems were really ever built to do. And so as good colleagues and as neighbors and as friends, we are helping them, and that will continue. The second question, unrelated, that came through is, are the staff working with COVID patients also taking care of non-COVID patients? And the answer to that is yes. Our nurses are trained and to don and doff the PPE, or put on and put off PPE, good hand washing, and good practices that allow them with no risk to go from patient to patient. Now, I did mention earlier that a number of our patients are cohorted. And so our COVID patients are together in certain areas of the hospital. That allows the nursing and the physician team to focus on primarily COVID or non-COVID. But there are occasions, if we're ruling out a patient, as in they've been tested and we're waiting for that test result to come back, there are situations, and this is routine, whether it's COVID or non-COVID, that those patients would be, those nurses and staff would be taking care of a COVID patient or a non-COVID patient. Okay. Okay. Gina?
Yeah, just another question. Someone was asking about ventilators, about what exactly do they do? Can you explain what the purpose of it is and how it helps someone heal?
Dr.
Koroly? You are muted. Okay, go ahead.
I'm unmuted, right? Okay. So, so a ventilator is a breathing machine. So if your lungs are so full or constricted and you take a breath, you just don't have the capacity to get enough air, enough oxygen into your lungs, and you will die if you can't get enough oxygen into your lungs. So what happens is the physician, who's usually for us an anesthesiologist, a critical care physician, an emergency department physician, takes a tube, a breathing tube, and actually puts it down through your mouth into your esophagus. And that tube is then attached, that's called intubation, and then that tube is attached to a machine. The machine itself, if you're too weak to take a breath, the machine kind of pushes the air into your lungs. And what we can do in that machine is we can adjust the settings. And what really helps in particular with COVID patients is to put high pressure air pushing right into the lungs. That's called positive end expiratory pressure, or PEEP. So we could turn that pressure up. It pushes the air in. We can adjust how much oxygen is in that air. So normally the air has a relatively low amount of oxygen, 20% or less. We could make it all the way at 50%, 60%, 80%, even 100% oxygen, and keep pushing high oxygen air into the lungs. Even if the person is sedated and sleeping, the machine will keep pushing it, do the breaths for it, in, out, in, out. And that gives the person time to heal. Hopefully the lungs heal. We give certain treatments, antiviral, anti-inflammatory, whatever we can. And then by the time it heals, the person can then start to breathe on their own, and we can disconnect the machine and remove the breathing tube. Does that make sense?
Yeah.
Okay,
Yeah.
so that's a ventilator.
There you go. So there's been some discussion about a shortage of medications that are needed to treat COVID at certain hospitals. So I guess, is that a problem here? Can maybe you discuss the supply chain and how you're getting the tools, materials, medicines you need?
Mm-hmm. So we're part of Northwell's supply chain, so we're all kind of working on this together. It's definitely a statewide and national concern, really, which is why we're careful, and we don't want to use the wrong medicine for the wrong indications, because otherwise supplies will be exhausted. So the main drug that has weak at best data to show that it can improve this virus is hydroxychloroquine. It traditionally has been used for malaria, and it's used for a couple of other diseases like lupus and some other things. It's not commonly used by many people, or it hadn't been. When word got out that this was the one drug that maybe has some data, of course, everyone's, we have some unfortunate doctors out there self-prescribing it and hoarding it and stocking up on it. I'm not talking about our doctors, other doctors in the area. And people just wanting it and taking it preventively, taking it because they have a slight sore throat. That is completely inappropriate. And that kind of behavior is what will exhaust the supply. So New York State has a directive. They almost made it against the law now. Doctors are not allowed to prescribe it. The pharmacies will not fill it for the average person. So this is going to stop. So right now we have an adequate supply throughout the Northwell system. We've been using it as our primary drug for admitted patients. It is not indicated for somebody, even if they have COVID. Most people, remember, we're seeing a skewed population that's very sick and on these ventilators. Most people do fine. They have fever, they have body aches, they feel weak, they feel tired, they cough, and then they get better with no treatment other than a little Tylenol and rest. So those people should not be using hydroxychloroquine, not only because of the supply, but there are side effects. And why would you take that risk when you don't need to? So the only time we're using hydroxychloroquine is if it's a patient that has to get admitted to the hospital, their oxygen level is low, and or they have pneumonia on their chest X-ray. So then we use it, and we have enough of it for now, but I'm glad that the law now doesn't allow pharmacies to dispense it willy-nilly to anyone that's asking for it, because that will take it away from the people that really need it. And then there's some other drugs. Some of the manufacturers, it is true, they can't make them fast enough. There's a drug, remdesivir, the few that I mentioned that we're doing clinical trials with. We're holding on to them. We do have a supply, so we're making sure that, again, if somebody really needs it, we're going to be able to give it to them. But if people use it too much, and if the numbers increase too much, then it could be a problem, which is why it's so important to develop these new clinical trials, get more data, get more drugs out there so that we can fight it better.
Excellent. Thank you, Dr. Koroly. So a question came in around, they're particularly concerned around some of our most vulnerable populations who do not have access to medical insurance or a primary care physician. What are we doing, or how should we be referring these patients to care? And Dr. Koroly, you may have some feedback on this. I will say initially that if anyone has symptoms or questions, please call our emergency department or please call our hospital. We have a team that has been in place for the past 4 weeks, staffed by nurses that are answering questions as they come in. It will prompt you to leave a message, and just get to our main hospital number on our website or the emergency department, and you will be directed to this. We are here for this community. Please do not let cost or insurance become a barrier. We are here and will take care of anyone despite their insurance status. Marla, is there anything you'd like to add?
I mean, there's other, we always partner with Open Door Family Health Clinic. They're right here in Mount Kisco. They do primary care. Again, they're call first because we try to, we're trying to avoid too many people going into the doctor's office. So that's another resource.
Great. Another question came in on how are you preparing for what we're hearing in the news around a potential surge and having limited beds and availability for patients. So earlier we mentioned that the hospital has been actively planning for surge and for patients since January. And as we've been doing this, we look at traditional beds in the hospital. I mentioned earlier that we have almost another 50% of beds available today. That was due to our decision several weeks ago to pause on elective surgery. That created capacity. In addition to that capacity of what I'll call traditional hospital beds, we've been actively working on what we'll call maybe non-traditional hospital beds. So these are PACU or recovery bays. These are areas that traditionally can treat patients very well. It is not a tent necessarily in the parking lot, although if the levels get to that point, there are hospitals that are actively planning for that. We are actively working with a local nursing home that has tremendous capacity, and we are working over the next 7 days to add additional capacity through beds in the community that will help us with non-COVID patients in that nursing home, because that is a vulnerable population we'd like to continue to protect, our elderly. That will then free up additional space within the hospital for us to accommodate more COVID patients. So there are a number of plans that have been activated and are well beyond the planning stages. And as we look and hear what the governor is saying, that we could be seeing a peak as of early as April 15th. Some of our models within Northwell over the next 7 to 10 days, that'll get us very close to what the governor is saying. Based on the data in Northwell is blind that we could be seeing this peak, or at least get potentially worse than we're in today in the next 7 to 10 days. And the hospital prepared for that surge. We have plenty of capacity at this point, and we have a lot of creative solutions the governor has challenged all hospitals on, and we've met that expectation and that challenge and are ready to take care of surge. Another question. Oh, I'm sorry, Dr. Koroly.
That's right. I just had 2 questions that I just got. Do you want to
Please
do your other one first?
Yeah, let's go ahead and answer those 2 questions and then we'll wrap up.
Okay. So the first question somebody sent was whether or not the virus is airborne. So that's an interesting question because we're kind of treating it as if it's airborne, but officially it's not. It's actually really what we call droplet. So that means that if you cough and if the person who has it coughs or breathes close in the area, the droplets will stay for a short amount of time. And if you get close to that person, you could breathe in that droplet. That's not typically airborne. And the way to protect that typically is this kind of mask. Very easy. You won't breathe in the droplet. The person is wearing this kind of mask so they won't exhale the droplet. And then again, I've said it 1,000 times, hand hygiene, because you're going to touch those droplets as they land on furniture and you need to wash them off. The typical airborne virus is something like measles. Measles is the most contagious virus that we know of. So that is truly airborne, which means that if somebody has the measles and walks into a room and then walks out, for the next hour or even more than an hour, anybody that passes through that same room, even if the person is gone, will easily get measles if they've never had the vaccine. That's airborne. Coronavirus is not like that. It's not as nearly as contagious as measles. It's, as contagious as a cold. It just has a more severe outcome than the common cold. Common cold is actually often a rhinovirus or a coronavirus. So it's not quite airborne, but because our staff that care for patients are doing such intense procedures like putting that tube down their throats or swabbing deep into their throat or giving them breathing treatments, doing all sorts of care, all the droplets will come around, which is why we treat it like airborne and we use all that extra protective equipment. The second question, I don't really know the answer to, unfortunately, but the second question was about vaping. Are people at more risk of having a bad lung involvement with COVID virus if they vape? We just don't have that information. Vaping, the studies about vaping, we know it does a lot of harm, in particular if it has THC in it in general. So I can only guess that if somebody is vaping, they're more likely to get progressive, but that's completely a guess. There's no data out there right now. Anecdotally, we had one person at this hospital who was pretty healthy who got pretty sick. And the physician taking care of them, just in passing, said, I said, why did they get so sick? They don't have lung disease. They have no underlying disease. They're not elderly. And she said, he's vaping constantly at home. So that was our theory. But again, there's no data to support that yet. So, but I still recommend against it, of course, but no data.
Great.
Okay.
Excellent. Thank you, Dr. Koroly. So as we wrap up, and before I do that, Gina, is there anything you want to say before we wrap up and conclude this webcast?
Yeah, I think that one of the questions that I got most frequently was, how can people help? What can they do other than obviously stay home? But is there anything else that they can do to support the hospital? And so I'm going to put one thing out there. I know that there's a special COVID fund that's been put together by Northern Westchester Hospital. You can find that on some of our Facebook updates, but I'm sure you can also find that if you go directly to the hospital's website. So I know that those donations are being used to assist patients, to help with supplies, a whole variety of other ways. So I know lots of folks are in an economically challenging situation right now, but if you do have the bandwidth, that would be financially a great way to help. Any other ways in which the hospital can use support from the community? You're here for us. We want to make sure that we're here for you too.
Yeah, Gina, thank you. And we can't express enough gratitude for you and for this entire community that spans for miles and counties and different communities surrounding our hospital. Frankly, the community is already doing it. You are sending us cards. You are supporting our staff with food. You're drawing sidewalk chalk. These things are helping us come together as a community to fight this battle. And so we would appreciate any financial support during this time. But we know that many of our communities are struggling. And, you know, our number one goal is to fight this virus, get patients well so that people can get back to their normal day-to-day and we can all get back on our 2 feet. So we thank the community tremendously for the support that you've been offering us. And our nurses, our physicians, our support teams feel that support. It's palpable. And I just want to end with a plea to continue to follow what our local leaders are advising and to stay home. The quicker that we can stop the spread of this virus, allow our patients to go through the course of treatment, come into the hospital, leave the hospital, the quicker that this virus can go away. And I do want to mention briefly that on a very positive note, patients are getting better. We have seen tremendous wins of patients that we thought were struggling and were struggling that are now home and recovering and back with their families. Just in the last week alone, we have discharged about 35 COVID patients who are now home safe, back with their families. This virus will continue to hit us hard. We don't know what is going to come, but we are here for you as a community. That's why we exist as a community-based hospital. If you have an interest in learning more about what we're doing, how you can help, please go to our website, which is nwhc.net. So that's nwhc.net. And we are here for you. This will end. We are optimistic that, let's call it in a few weeks to a month or so, we will be back to normal. But in the meantime, we're here for you. Our teams are working tirelessly to make sure that they receive the utmost professional and best possible care during this trying time. So we want to thank Dr. Koroly and Gina, Mayor Picinich, of you, and thank you for all of those who joined us this afternoon. We will try and keep you updated through our website and through our kind of social channels. Please stay connected with us. We are in this together, and we are going to emerge stronger out of this because of this. So thank you to all of you. And we hope you have a great afternoon.
Thank you.
Stay well, everyone.
Thank you very much. Be safe.